Good afternoon, and thank you for joining us for this community briefing on COVID-19. Joining me again today is interpreter Margie Prop, and thank you as always, Margie, for being here to offer your services. As we shared on Wednesday this week, this has been a difficult time for our community with 6 deaths this week from COVID-19. Our condolences go out to all those who are mourning the loss of loved ones in our community. To prevent further loss and suffering, let's recommit to the proven public health precautions that work. Let's wear our masks, let's watch our distance from others, and wash our hands. Public health officials across the nation are urging everyone to take these precautions whenever we are with people who aren't, with people from outside of our household. For more detailed information about how to stay healthy and safe, as well as how to access resources available to residents and businesses during this pandemic, please go to our website at covid19.lincoln.ne.gov. You'll find there a dashboard with the latest COVID-19 data and information, which we update daily at about this time. At our website, you'll also find our COVID-19 risk dial, a color-coded tool that communicates the level of risk for COVID-19 transmission in Lincoln and Lancaster County. And we update that dial every Friday. We're here to tell you today that this week we are moving from mid-orange to elevated orange. This indicates that the risk of COVID-19 transmission in our community is increasing. We have not been in elevated orange since the dial was introduced May 11th. Today in Lincoln and Lancaster County, an additional 112 individuals have tested positive for COVID-19. The total number of lab-confirmed cases is now 7,289, and our total recoveries identified to date are up to 3,132. Health Director Pat Lopez is here today to update us on the indicators used to determine the position of the risk dial.
Thank you, Mayor. The Health Department uses data and trends from the past 3 weeks in 5 primary areas to determine the risk of COVID-19 to the public. Most of the data is available to the public on the COVID-19 dashboard. The website also includes an explanation of the metrics we use to determine the dial position. You'll find that just underneath the dial on the website. One primary factor is the number of new cases. This week, so far, we have 432 cases. Over the past 4 weeks, we have had an average of 600 cases per week. Our case count has risen each of the last 3 weeks. In the past 6 weeks, beginning the week ending September 5th, about 3,400 people have tested positive for COVID-19 locally. This is almost one half of the total cases reported since the beginning of the pandemic. The 7-day rolling average shows a fairly flat trend line with daily cases averaging in the mid-80s. We have seen these very high levels of cases for 4 weeks now. A second factor is the positivity rate. The average weekly positivity rate remains in the teens, as it has over the past 6 weeks. So far this week, it is 12.5%. This is a strong indicator that the virus is widespread in the community and the risk of spread is high. Another factor is laboratory testing capacity and turnaround time. While testing remains widely available in the community, the effectiveness of testing is highly dependent on how quickly the laboratory results are reported to the health department. Over the past 2 weeks, the average turnaround time has increased by almost 2 days. The average turnaround time was more than 4.4 days this week. And then contact tracing is also, our capacity is also another primary factor. The sooner test results are received from the labs, the sooner public health nurses can begin the important step of contact tracing. This is critical in preventing community spread and outbreaks. Our public health nurses are making contact within 24 hours of receiving notification from the state on positive tests. However, due to the over 4-day turnaround time, our nurses typically have not been able to contact patients until the 5th or 5 or 6 days after they were tested. Once Link and Lancaster Health nurses make this contact, then the contact tracing process begins. Obviously, contacting people almost a week after they were tested makes contact tracing much less effective in preventing the spread in our community. The fifth primary factor is the number of people hospitalized for COVID-19 locally. As we've been reporting, the number of COVID-19 patients in Lincoln hospitals has remained high over the past few weeks. The average weekly number of Lincoln and Lancaster County residents hospitalized increased from 9 per day in early September to 38 per day in the past 2 weeks. When we add in patients from outside of Lancaster County, the average number of people hospitalized at Bryan Health and CHI St. Elizabeth's over the past 2 weeks has been 65 per day. Today, 59 COVID-19 patients are being reported and 11 are on ventilators. 31 are Lancaster County residents and 6 are on ventilators. 28 are from outside the county and 5 of those individuals are on ventilators. This map shows how metrics associated with these primary factors are plotted on the color-coded risk areas. Almost all of our measures have moved from last week toward the upper right portion of the chart. The only metric near green is testing availability. The only measure in yellow is contact tracing. Connected cases, ICU availability, positivity rate, and testing turnaround time are all right on the threshold of elevated orange. In elevated orange and red are the remaining metrics of community spread. Average daily hospitalizations, cases, and case rate per 1,000. You will find the location of the risk dial represented in the blue square outlined in red. It is in elevated orange. The data tells us that the risk of contracting COVID-19 in our community is higher now than it has been for many weeks. Now is the time to redouble our prevention efforts. Wear a mask, stay 6 feet away from others outside of your household, even when you are outdoors. Being outside definitely helps, but you can still contract this highly dangerous virus outside if you do not follow the precautions. Our contact tracing is showing that many of those who become positive for COVID-19 attended family gatherings or went to a party and hung out with their regular circle of friends. But they did not follow the precautions. They did not wear masks and they did not stay at least 6 feet apart. These are perfect environments for COVID-19 to spread. Of course, we remain concerned about large gatherings, but these smaller gatherings and people who are not taking the necessary precautions are a big contributor to the continued spread of illness and increased hospitalizations. Too many people have let down their guard, and these individual actions are impacting our whole community. When you keep yourself and your family safe, you contribute to the overall health of our community. You help to prevent illness, hospitalizations, and deaths. You help to keep our schools and businesses open. We can still enjoy life during the pandemic, but we must do so in a smart, safe way, and we have many examples of that throughout our community. Health department staff have provided technical assistance to dozens of event planners, small and large businesses, school systems, and government agencies, helping them operate safely. In September and October, we've reviewed or approved 23 different events, such as Boo at the Zoo, drive-through trunk or treat events, activities at Rocaberry Farm and Pinnacle Bank Arena. We've worked with the NSAA on district and state football and volleyball, and with the Lancaster County Event Center on the Ag Expo. LEBA, the Malone Center, and Parkway Lanes have worked with us to make sure their events are safe. The health department continues to work with local public and private schools to review plans for upcoming events, including theater and music performances, athletics, and facility use by outside entities. We share this to highlight that Lincoln and Lancaster County are still great places to live, work, and play. You can keep it that way by wearing your mask, watching your distance, and washing your hands. We need people to keep that in mind as we get ready for Husker football. The health department and other city agencies are working with businesses and event organizers to develop protocols for football-related gatherings and events like tailgate parties. We are also asking the public to make choices that do not put their health and the health of others at risk. A phrase you will hear a lot in the next few weeks is home gating, small gatherings that involve no more than a couple of households. We have posted some ideas and some safety recommendations on our COVID-19 website. Husker Athletics is a unifying force for our whole state. Let's keep that enthusiasm a source of pride by keeping our game day activities safe.
Thank you, Director Lopez. That is certainly an impressive list of groups, venues, and events that are working with you and your team at the Health Department to host the public safely. And we're so grateful to all the community organizations who are working with the health team to do that. One of our health team's closest and most significant partners in protecting the public continues to be our Lincoln Public Schools. And thanks to LPS's commitment to practices that prevent the spread of COVID-19, after 8 weeks of in-person classes, we still have no evidence of the virus being transmitted in the classroom setting. That said, with the newly elevated risk of the virus spreading in our community, we have invited LPS Superintendent Dr. Steve Joel here to join us again today with an update on how LPS and our health department are working closely together to best protect our students, staff, and teachers.
Thank you, Mayor. I appreciate very much the opportunity to be here, and I want to begin my comments by, first of all, thanking you again for your leadership in the community. This has been very, very difficult work for all of us, but your work and your leadership in helping us make good decisions has been very helpful. I also want our parents and community members to know that we have a fantastic health department. We meet weekly with Director Lopez and her team. We have special meetings several times a month centered on our questions, our concerns, things that are raised. And what I think perhaps some in the public don't understand is that the health department knows how important education is in this community. And so we've been able to put a plan together that we believe has been very effective in limiting and mitigating risk within our schools. And as the mayor just proclaimed, we have not had any verified evidence of any school spread. And that's because our students are doing a fantastic job and our staff are doing a fantastic job. But we're in this for longer than we expected, and we have to maintain our vigilance. Several weeks ago, we announced that beginning October 19th, we would move away from the AB high school schedule to one that allows for 100% of our students to attend high school if they so desired. We also said at that time that that move would be contingent upon current local conditions. And it seems that from the moment we made that announcement to today, we've not done very well as a community. As Director Lopez mentioned, numbers are going up, hospitalization rates are going up, and sadly, fatalities have increased as well. And so in light of that, and because we want to continue to be a good community partner and do our part, we are going to delay the 100% opening and maintain the AB high school schedule with the intent to continuously monitor and truly hope and desire that we can move back to that 100% because we know our students want to be in school. We know our parents want our students to be in school. And I want you to know I feel badly about that because we've said from day one our goal was to get all of our students back with their teachers, back with their friends, back with their activities and their academics, but conditions just won't warrant that occurring. So while we feel really good about the remote learning that's taking place right now and how hard our teachers are working to not only teach remotely during a class period or an academic day, but also working with their in-person students who need their time and attention, We know that this has created a large burden on our teachers. And I'd like to make sure that I always take an opportunity to thank them for their professionalism, their commitment, their dedication, and to thank the parents and the students who acknowledge that. We're asking our teachers to really do something that they haven't had to do before and does require an awful lot of extra work. We've also noted that some of our remote students are not being very vigilant and diligent with regard to them committing themselves to their academics. And so again, we know that having students back in school full-time is in their best interest and our best interest and the community's best interest. While we've certainly had numbers of cases within our student and staff ranks, as I mentioned before, we believe our schools are safe. We have not had school spread. We have not had difficulties with students wearing masks. Staff report consistently that more parents are opting to come back into our schools from remote learning. We consider that to be a positive. But more than anything, the dedication and commitment of our staff has made the difference. But we want our kids back in schools. But we also have to be community-minded. We have to do better as a community, and that includes the schools, with regard to limiting and stopping the spread of COVID-19. While we know that what's happening during the school day is positive and effective, it's only for 7 hours a day that our students are in a very safe and hopefully risk-free COVID-19 environment. But it's when our students leave school, it's when our staff leave school that they have a tendency to let their guards down. And so as we've been looking at cases, we know that that in fact is what's happening. And Mayor and Director Lopez, we have to just continue to reinforce that even if we're outdoors, even we're at friends' house, even if we're getting ready to celebrate Husker football, we have to follow protocols. Because if we want our kids back in school, it's going to take every single one of us to make that kind of commitment. And I know it's not comfortable. I know it's not something that comes easy for us and we want this to go away, but we have to lead through it and we have to work through it and we have to power through it and we have to do it with execution of protocols. So it's through this concerted community effort that we can lower this risk of spread and get these numbers back down to where they want to be. And I'm looking forward to hopefully not in the too distant future of bringing all of our high school kids back into school. And so with that, I just want to summarize, we are again going to delay the 100% high school attendance. We're going to maintain the AB schedule. We're going to evaluate it on a regular basis and continue our work with the Lincoln Lancaster Health Department in terms of any future decisions we make about that. So Mayor, again, thank you very much for carving out some time for me to give an update.
Thank you, Dr. Joel, for your leadership and to everyone at LPS for doing everything you can to keep our community safe. And I want to echo your sentiments about how disappointing it is for all of us. These decisions, we feel them not only in our professional roles, but in our personal lives. I have a high school student who would love to be back full-time, and I've zoomed into parent-teacher conferences and seen the stress and the wear that our teachers are experiencing as they try to teach both in person and on Zoom at the same time. These are difficult challenges and we're asking them to rise to the occasion, and they're doing it. And what we can do as a community is support them. Each of us has a power to make their lives easier and better. Each of us can do our part to limit the spread by following these precautions when we're in our circles of friends, when we're out in public, and when we're with family. So we all have a role to play in getting our children back in the classroom, and we invite you to be a part of our solution. As the pandemic continues, it is, of course, normal to feel a range of emotions, and among them include fear, sadness, disappointment about announcements like this, and helplessness. One Lincoln woman, a former nurse, has looked for a way to express our collective empathy, our compassion, and our care for all those who are hurting during this time. Kathleen Allen came up with a simple idea: 10 minutes of silence, prayer, and reflection at 10 a.m. tomorrow, 10/10/2020. Her simple idea has become a national movement, and we are so pleased that Kathleen can join us by Zoom today to tell us more about a time of remembrance. Kathleen, over to you.
Thank you. First of all, Mayor, I want to thank you for the incredible job you're doing to protect the citizens of Lincoln in this pandemic. Your efforts are saving countless lives. Thank you so much. I'm grateful for the opportunity to share with you about a time of remembrance. 10/10/2020, as you said, we're asking everyone across the country to pause at 10 a.m. their local time for 10 minutes to reflect and pray in their own way for the victims of COVID-19 and for their grieving families. We've lost over 212,000 lives in the United States, and there's a need for collective mourning to acknowledge the loss of so many in this ongoing tragedy. And we want to spread compassion to those who are hurting. We hope to begin a national conversation about healing and to build a coalition of compassion. And the beauty of this project is its simplicity. And we are just so touched by how everyone is embracing the concept from coast to coast. So we're just asking people, wherever they may be, to pause, to honor these lives and unite tomorrow morning and help each other heal. We hope to hear church bells ringing all across the nation. And everyone can be involved by sharing this with their network of people through social media. And you can just share. We have our hashtag is #pause for the pandemic. And there's also a Facebook page, A Time of Remembrance. We feel that this moment is going to make a difference. And we want to remind everyone we're in this together. And we want to honor the dead. We want to hope for the future. And we want to heal our fractured country and spread compassion everywhere. So it is my honor to share with you about our message today. Thank you.
Thank you so much, Kathleen, for your compassion and for giving us a meaningful way to honor and remember those who we've lost, and in the process bring some healing and support for all those who are suffering. Thank you so much.
Thank you.
Finally, today, I want to recognize an important member of our city communications team. LNK TV manager Jamie Wentz is behind our camera right now. And because of the importance of the information that we present in these briefings, we have committed to making them as accessible as possible. And the information is translated into several languages, and we have enjoyed having sign language interpreters like Margie here to help with that. And you may have noticed that we've also introduced closed captioning. In fact, closed captioning is now available on all Link TV programming, and Jamie Wentz has worked very hard to make that possible. And to recognize his efforts, the Nebraska Commission for the Deaf and the Hard of Hearing has named Jamie Boss of the Month for October. So congratulations to Jamie, the man behind the camera, and thank you for all you do for our community, like a boss. And with that, we'd like to open up for questions from the media.
This is Brent with Channel 8. If the numbers, and not just the cases, but hospitalizations and basically all the factors that go into the risk dial, if those are all similar or stay relatively the same, would that be enough to move the risk dial to the red next Friday?
I'll invite Director Lopez to come up and answer your question, Brent. Thank you.
Hi, Brent. You know, as I believe said on Wednesday, and now we use 3 weeks worth of data, and there's a lot of variation in the data that we receive. So based on the metrics that we have right now, if we had the same metrics, we're going to be in the same place we are now. And I think probably for the last 5 weeks, we were really at mid-orange. One of the things that's really impacting us, of course, we still have hospital capacity, but our testing turnaround time is really a great concern. And so that played heavily in the weighting if you look at the metrics.
Another question for you. I think the latest numbers from LPS show about 215 cases. You and Dr. Joel said they're not getting infected at school. There's not
No.
spread
There's
at
not.
school. So through contact tracing, where have you found that these students are getting it?
You know, Brent, about 40% of our cases in Lincoln are related to contact with another positive case, generally somebody in the family or a close relative. And generally, these students are doing other activities with their family outside of the school setting, and that's where they are contracting the virus. And we're seeing that not only here in Lincoln, but in a large part of our state as well. So it's really the activities that are going on when our students aren't in the school. In fact, many of our health directors told me this morning that one of the greatest things that could happen is if our communities followed all the safety measures that the schools have in place.
So they're maybe contracting it from a family member at a gathering,
Right.
and then they're still going to school, but there's no evidence in any case so far that, whether they know they have or not, that they've infected someone else.
Right. We do not have spread in the classrooms, and we're very vigilant about that, and all of our schools are vigilant about monitoring that. But I think one of the important things for us to remember in Lincoln also, our schools started out together, except for the 50-50 and the high schools at LPS, but all of our students have been wearing masks the entire time. And that has not been the case in several other areas of our state, and they have changed that process, especially with the last DHM from the state, and that has stymied the spread in the classroom in several areas across the state. So we do know that the mask wearing in the classroom has been a tremendous benefit in keeping our students in school, which means their parents can be at work and they're getting an education.
Hi, this is Mackenzie Huck from 1011. I have a question for Dr. Joel.
Yes, ma'am.
Hi, Dr. Joel. Do you have any kind of updated timetable on when you guys would like to go back to 100% in person, or what kind of factors, what would the risk dial have to look like in order for you to feel safe making that decision?
Complicated question, Mackenzie, and as Director Lopez has indicated, there's a lot of metrics that go into the risk dial. So really for us, it's going to be conversations that we'll have with the Lincoln Lancaster Health Department. We'll look at ourselves internally as well, and we are concerned sometimes with if numbers continue to go up, and I think if I remember correctly on our dashboard, we have 119 adults right now that are in isolation. They don't have the virus, but they've been identified as a close community contact. So there's just a lot of things we have to look at. But to answer your question, personally, I'd like to see us go back in 2 weeks if we just hit a home run here and drop the COVID-19 infection rate down to something that's very minimal. Very unlikely, I know that, but we're going to look at it on a regular basis and just make a decision as conditions warrant.
Is there anything that you think the district can do to improve those chances of going back to in-person learning?
Yes, there is. If everybody in our employ talks to 10 people this weekend and tells them if they're not wearing masks, if they're not distancing, if they're not hand washing, if they're not taking care of themselves, that the only way that we're going to get back to school is if they do, then perhaps I'm hoping that we can make a difference. It's going to, like I said before, it's going to take a complete community effort for us to be able to get all of our students back in school. And we've let our guard down, and we've got to get it back. So my hope is, as much as I know high school students are going to be bitterly disappointed with this decision, I'm hoping that they turn it into a proactive activity and go out to the community and say, do your part. If we all do our part, we can drive these numbers down, we can make Lincoln more safe, and we can get all of our students back in school.
Thank you.
Dr. Joel, before you leave, this is Bill with 1011. The most recent numbers we have for remote learners was about 21% at the end of August. I was curious if over the last 6 weeks you have any data or if you've seen that increase even more.
No, it hasn't increased. In fact, it's decreased. We're in the teens now. We've had I don't have the exact numbers, Bill, so I don't want to be quoted on it, but I think most of our principals are reporting that we're seeing more and more of our parents coming back into our schools, primarily at the K-8 level, of course, because 9 through 12 is limited by the AB schedule. So, we take that as encouragement, because students in school are, they're going to do better around their teachers. We'll try to get some of those numbers updated. Tuesday night, school board meeting, I give a pandemic report. I'm planning on giving a rather thorough report, updating on a lot of different experiences that we've had and data that we've had, and might be able to pull those numbers together for you.
From everything that I'm hearing from Director Lopez, from yourself, really it's your belief that schools are the safest place for children, correct?
Yeah, I think they are. I mean, I've been in 40-something schools. I haven't seen a student without a mask. I haven't seen a staff member without a mask. Our teachers have reported that for the most part, they feel safe. The students are compliant. It's working. I mean, it's working preschool through 12th grade. And we've had very little, if any, incident that would cause us to be concerned. So, we feel like the school is safe, and I believe that the masks make all the difference in the world, and if people believe that, then why not carry that forward into our daily lives in the community? And that's why I think we are safe, and that's why we're not seeing school spread. But again, as soon as school is out, we know our students and our staff then go into their personal lives, and they may not necessarily be following good protocols. So we're asking people to do a better job with that.
Is there an argument there that, in fact, it would actually be safer to go to full-time schooling rather than hesitate to get out of the AB schedule?
There probably is an argument there, but I'll tell you that our high schools are overcrowded, which is why we've got 2 new high schools coming. And these are older kids that are more likely to spread because of distance. Lincoln East is 2,400, almost 2,500 students. And so, we knew that going in, and we also knew conditions had to be really good for us to increase from 50% to 100%. So I would take the other side of that argument and say, I think a big reason why we're not seeing community spread, even in our activities, we've had a couple of limited incidents, is because we're following those protocols. But right now with the rate where it is and the number of incidents, it's just not advisable for us to bring all those older students back into school. But we're going to do everything we can to bring them back as quickly as we can.
Thank you, Dr. Joel.
Riley at the Journal Star with questions for Director Lopez.
Good afternoon, Riley.
Good afternoon, Director. First, for those that are maybe less familiar with the risk dial, could you talk about what the move into red would trigger at the health department in terms of any restrictions or whatnot? And secondly on that, how close are the metrics right now to what the metrics would need to be to trigger the red?
Riley, there's still movement available on some of our measures. We're working hard to improve. If we were to get to red in the severe area, I would have to go back and review some of the data again. But we're talking about a situation where we're probably talking about closing some activities, probably doing things like remote learning. And we're not anticipating that happening. I know we're close, we're high orange. But unless we start to turn things around, which is what we're working really hard to do, and our community's been responsive, we are planning for things to improve in the community, but we're constantly monitoring. So if we would get to the red area, we're going to go back to having to put some restrictions in place to reduce the spread so that we're able to take care of people.
As a not necessarily direct follow-up, I do have some flu-related questions.
Okay.
First, will people, obviously the health department's been encouraging people to get their flu shots by Halloween. Will people on their own be able to distinguish between influenza and coronavirus, or will they actually need to get tested to assess what they actually have?
Riley, that's a great question, and thank you for asking. I mentioned our vaccine committee, and we'll be doing a more full report next week on the recommendations, but those are areas we're looking at. We have started our monitoring that goes on with 24 of our private practices, our hospitals, our schools, and other systems about what's happening in the community with flu. So that's one of the measures we use, and in consultation with our infectious disease doctor for the health department, we're looking at when that trigger becomes doing COVID and flu testing at the same time. And of course, it's always going to be up to the person's primary care provider to base what needs to be done on the symptoms that individuals are presenting. I just finished a noon conference with our physicians, sponsored by our Lancaster County Medical Society at noon today, talking about these very factors. And I need to tell you, our healthcare providers in the community are very engaged.
Second question on that topic. Is there evidence the health department's received yet that more people are getting the flu shot this year as opposed to a typical October?
You know, Riley, we're too soon to tell, but we're keeping those numbers. I do know that we had a smaller clinic yesterday, and we had 148 people come in. We also have several sites. We were in 2 of the middle schools this week. We'll be in another middle school next week, I believe on Wednesday. And we are also going to several locations in the city, and we're planning some mass vaccination clinics. We spoke with 2 of our rural schools. There'll be some of the places that we're going to be at. So I think our full schedule, we're planning on having available by Monday.
And lastly, on flu, are there any sort of forecasted trends the county health department can make about this year's flu season based on how the pandemic's played out, or any of the factors, the mask wearing? Are any predictions, on flu available yet?
You know, we've been watching what's happening in other countries that are in their winter season now. And what we're seeing in those countries where they've had the mask wearing and the hand washing, actually, their influenza rates are down. We would love to see that happen here, and I think it makes it even more critical, especially with influenza season upon us, that we really do wear a mask, wash our hands, and watch our distance. Riley, I also wanted to mention, just for the public to know, there is no charge for the flu vaccine being given by the health department. Our goal is that anybody who wants a flu shot can get a flu shot.
Director Lopez, before you leave the podium, also flu-related, do you have any documented cases in Lancaster County this season yet?
No, we do not.
Just want to add one tidbit of information about those free flu shots available through our health department. They're available to anyone in the community 6 months or older, and appointment is required. So if you want to schedule an appointment, you can call 402-441-8065 during regular business hours, weekdays between 8 a.m. and 4 p.m. Again, that number is 402-441-8065 to get a free flu vaccination. And with that, any other questions? All right. Thank you so much for tuning in. Thank you for what you're doing to help keep our community safe and healthy during the pandemic.